We move to Suffolk County. It has over 200 coronavirus deaths as COVID-19 just continues to rise. So does hospitalizations. So in efforts to beat the surge of cases, the White House sent 200,000 N95 masks to the county to keep up with supply. Joining me now, Suffolk County Executive Steve Bellone, joining me via Skype with the very latest update. So good morning to you, County Executive. First and foremost, I want to begin with the number of cases in your county. You have described this now as really a new epicenter here in New York. Are there specific areas in Suffolk County that you're seeing more cases than others?
Well, the cases are spread out throughout the county. We have more cases in Suffolk County than 46 other states in the country. And those hospitalization numbers continue to rise. The death toll, worst of all, continues to rise. 3 weeks ago, we didn't have a single death related to COVID-19. That number, as of yesterday, stood at 263.
And so I want to talk about the deaths for a second. You know, that is an alarming number, right, that we're hearing here. What we're seeing here in New York City is also a number of cases go up here, and they're running out of space to keep unfortunately, the bodies. This is a morbid conversation and hard to talk about. But what are you doing right now as morgues and funeral homes just cannot keep up with the demand? I understand there were some reports of ice rinks being transformed and farm fridges being transformed. What can you tell us this morning? It's difficult, but I think families need to know this as they want to plan funerals.
You know, it's hard to imagine that every morning as we do our conversations with our emergency operations team, that we have conversations about morgue capacity and the number of body bags we have. I would have never imagined being in this situation, but those are the things that we have to talk about and plan for. And we have, as part of the planning, increased our morgue capacity significantly. I'm confident that we're able to handle, even in a worst case scenario, what we will need to do.
Right. When you talk about increasing more capacity, though, can you give me specific details about those reports about ice rinks or farm fridges?
Well, those were reports that and discussions that happened very early on, and some of the people, as part of our emergency operations team, raised the prospect that we may need to look at ice rinks because you need large refrigerated space in order to handle what could have been happening in a worst case scenario. We added additional mobile refrigerated capacity to the medical examiner's office, and also looked at space in the county that had refrigerated capacity, brought that online.
We're starting to hear things now about racial disparities in terms of coronavirus cases. Are you seeing anything like that play out in Suffolk County? Do you have those numbers? And when we take a look at testing, for example, is testing available for and widespread, especially for those who are non-English speakers?
I think it's important to understand that if any of the problems that have existed prior to this epidemic happening in normal times are only going to be exacerbated by what's happening with coronavirus. The fact is we have significant health disparities when it comes to communities of color, and we're seeing that play out here in real time. With respect to some of our
how do you fix that?
Well, it's a challenge to do that now. We need to fix that in our healthcare system. I think that's one of the reasons that healthcare is one of the, if not the top topic in our country today. But responding now, we are to testing in hot spots in the county that are difficult to reach communities, some of our immigrant communities, where the messaging may not be getting through.
Understood. I know we're having a little difficulty hearing you, but I just want to ask you one last question. Moving forward, I know we want to worry about the here and now, but is there a plan moving forward to kind of improve testing, antibody testing? What's the next step moving forward in this chapter besides mitigation right now?
I think the governor has talked about antibody testing. We've had conversations with a number of different providers. I think antibody testing is going to be critical ultimately to get people back to work, to get our economy back in line as we understand who has had this virus. From the very beginning, we saw when our first case was confirmed on March 8th, and then the cases in the days after that, that this had really spread throughout the community before we started testing. So testing is critical, and I think the antibody testing will be the key to bringing our economy back on.
Understood. Suffolk County Executive Steve Bellone, I do appreciate your time this morning and laying things out for the folks in your county. Stay safe to you, and thanks again for coming on.
Thank you, Dan.